Before any standardized cancer treatment makes its way into the clinic, it starts with a clinical trial. And every clinical trial, in order to be run effectively and efficiently, starts with a protocol. A few issues in clinical trial development in oncology include the time it takes to develop these protocols, which are very dense documents. These can stem from disagreements among stakeholders, between investigators, pharmacy, the study teams, budget constraints, and a simple problem of version control. These documents are often written in Microsoft Word. And ultimately, where these are affected most are in lower budget investigator-initiated trials. So with us, we're proposing a web-based platform called Streamline. Our mission here is to expedite and enhance protocol development through design standardization and AI comparative analysis.
So the way we would be doing this is gathering and comparing past IRB-accepted protocols while the protocol is being designed, using natural language processing through platforms such as IBM Bluemix, which allows you to use it for free up to a certain user number, and then we could kind of expand on that once we've established a base. And the big thing that we want to market is this stream score, a kind of rating that you can generate based on the protocol you're designing, using guidelines from Spirit, feasibility of the budget, and your likelihood of IRB acceptance. That gives you a quick, easy representation of a likelihood that your protocol would be accepted by an IRB.
So let's give you a little example. This is our demo. So let's say you wanted to start a new protocol. You're just setting up your clinical stuff. So it's going to ask you some preliminary questions in order to optimize the way in which it's going to design the protocol for you. So let's say you wanted to do an interventional one. You say, does this affect cancer? You can do a full setup, which will have a long form questionnaire, which will get a lot of details about what kind of study you want to do. Or you can do a quick setup, let's say if you just wanted to know even if you needed to get an IRB score. So it optimized the thing for you. You could go through to answer these few beginning questions. Let's say you wanted to do progression-free survival and overall survival. You keep going. And now you need some characteristics. So if you say it was pediatric, if you say yes, it's going to tell you that you do need full IRB approval right away. And then you're going to go ahead and keep moving on. So where's our slide? Here. So this is what the main meat of our program is going to look like in the platform. You can see on the left that there's going to be all the different Spirit guidelines that you have to reach. It'll show you how far along you are. And then you can see with our AI technology through the Watson, it'll give you related protocols so that you can better write your own protocol quicker and more efficiently with ones that have passed IRB before. So moving on, basically looking ahead, what we're going to do is use that stream score to give you a grade in which you can theorize whether or not you'll pass IRB quickly and effectively. Over the long run, though, we can have protocol registries where you can quickly access protocols that have been proven to pass IRBs. So you don't have to have any kind of question. You don't have to make them up off the top of your head. They'll be there, and that'll be gathered over time. The protocol development standardization is a huge problem in clinical research, so that's going to get standardized if everybody uses this platform more and more. And the stream score, eventually we want to have it be like a credit score almost on your pre-IRBs. So that's going to be useful if you're looking down the road to phase 2. While you're on phase 1, you can get a stream score and say, look, we're almost ready for phase 2 as soon as this phase 1 wraps up. In the short term, obviously we need to get this off the ground, so maybe some STTR grants for initial funding before moving into research institution partnerships like here at Mount Sinai.
If this will write my clinical protocol, that would be very nice. You know, can you actually? I think you alluded to that. Maybe I just missed it, but. When you use artificial intelligence to extract out similar applications based on keywords, will it actually start to populate, you know, a working draft for you based on what is already out there?
Sure.
Because that might actually sell.
So the point of what we're suggesting here is that based on keywords in PubMed and based on what's reported in clinicaltrials.gov, which is mandatory at this point for therapeutic trials, we're going to suggest references that can help you help you move that process along, as opposed to writing it for you. What we see on the market currently doesn't really offer that. It offers you a way to organize things. It doesn't offer you the feedback from what existing literature can give you.
But long term as well, populating itself would also be feasible, especially if you're doing it inside the same institution. The way we thought of it was it'd be a subscription service for individual institutions. So let's say you're a pharma company, you have multiple people doing research similarly. You can share that protocol easily on the same platform to help it expedite the process if someone's measuring the same initial intervention as well if they're measuring similar outcomes. You'd be able to share that more easily, especially if it was published through this. Not published through this, but used before publishing.
And the thinking is that it gets better with time, because as we have more in our registry, we know what passes muster and what does not.
You are going to need IRB for everything. So when you sell this to a partner, saying this will allow you to make that decision, you're going to do that anyway. But getting it to help you write your protocol and know what other people are doing, that's.
Thank you very much.